A Catholic healthcare network in the U.S. is now covering transgender surgeries in its insurance plan. The change in policy came after PeaceHealth, a Catholic organization operating 10 hospitals in the western U.S., was sued by the ACLU. John Brehany is an ethicist at the National Catholic Bioethics Center in Philadelphia, and he joins us now. John, thank you so much for tackling this very complicated issue with us today. You said such coverage does fall short on Catholic ethical grounds. How so?
How so? Because the Catholic Church teaches that we need to respect our bodies and the integrity of our bodies. Certainly, someone might have a disease like cancer or gangrene or something in which they may have to sacrifice a part of the body to save the whole, but otherwise we should respect the body that we were given by God, and we believe that man was created male and female, and that our body shares in our human dignity. So some of the practices that we see in society of people trying to change the characteristics of their sex or gender identity really involve harming the body and aren't consistent with our Catholic teaching.
Taking it beyond ethics, John, some are concerned that PeaceHealth's decision is now setting a precedent, and it's a precedent that other private organizations could be forced to cover medical procedures that they have moral issues with. That's a big deal. What do you say to that?
Well, I'm quite concerned about it. The federal government under the Obama administration tried to establish by rule that all insurance companies, all health insurance policies and companies had to cover these procedures. And in fact, any doctor or healthcare professional would have to go along with them. So we already saw that coming from the federal government. What I'm concerned about in this decision is that PeaceHealth said, we will follow whatever Aetna, a secular health insurance company, says ought to be covered. They should be following our Catholic beliefs. They should not outsource an ethical decision to a secular insurance company.
How easy would it be to follow the Catholic beliefs? Is that a difficult decision to make?
Well, in our times when there's a tremendous amount of social pressure, it's hard to stand up for the faith. I think it's certainly possible to do it. We've seen many Catholic companies and health insurance companies saying we're not going to cover abortifacients, contraceptives, sterilization procedures. They do this already in other scenarios for other issues, so they could do it.
John, some argue that this decision, it's very personal, should be between a patient and a doctor. What do you say to that?
Well, I want to emphasize that the people who suffer from gender dysphoria are suffering a lot, and we really want them to have effective treatments and not treatments that are going to harm them. And yet what we see in this case and in other areas of the social debate is that they want other people to pay for it. That's what they want. You could say it's between them and their doctor, but they want everybody to contribute to paying for it and making it available.
All right, John, so much more to explore with you, but we have run out of time. Thank you so much. We're going to have you back.
I'd love to come back.
Thank you.